Have you ever had an idea that was so amazing that it could change the world? This podcast is called This Could Change Everything. And we're talking to people who are working on ideas that do just that. I'm Joe Kim, and I'm a professor of psychology, neuroscience, and behavior at McMaster University. I lead the McCall MacBain Postdoctoral Fellows Teaching and Leadership Program, and I love to talk with young researchers who are working to make a brighter world. Today, we're learning about helping adolescents with advanced cancer. Does that sound right?
It does. That's perfect.
Okay, let's start with a brief introduction. Tell everyone who you are, and maybe give a 1-minute elevator pitch about your research.
Sure. So my name is Andrea Johnson. I'm a postdoctoral research fellow in the Faculty of Nursing at the University of Toronto. And I'm also a research fellow at the Hospital for Sick Children in Toronto. And so my research is really focused on adolescents living with advanced cancer. And approximately up to 40% of adolescents diagnosed with cancer will not survive their cancer diagnosis. And actually, adolescents lag behind in rates of survival compared to both children and adults. So comparatively, far fewer adolescents will survive a cancer diagnosis. And so this means that a significant number of adolescents with cancer will access palliative care. This is really specialized healthcare designed to really enhance their quality of life. And this is where my research comes in. Although committed to quality of life, we know very little about what quality of life means for adolescents living with advanced cancer. And without knowing what it means, it's really difficult to know how to improve it. And so my research is really working with adolescents with advanced cancer to define what quality of life means for them, and then to develop a standardized approach to measure quality of life, really to arm clinicians to best respond to the care of this population.
This is such a difficult subject. And the first thing that really strikes me is that I'm surprised that adolescents have such a high rate of mortality compared to children and adults. Mm-hmm. Can you tell me about the needs of adolescents who are dealing with a serious cancer diagnosis?
Sure. So maybe I'll start by just sort of offering a response to your comment, because I think that really contributes to why this population is quite distinct. So there's different reasons why adolescents have a greater mortality compared to both children and adults. There's often delays of diagnosis, and when we care for them, their cancer is quite advanced. They're a population we enroll on clinical trials to a much slower degree than children and adults because they're hard to consent. We have to consent parents and adolescents, and the biology of their cancer is actually quite distinct. So sometimes their cancers are not pediatric, they're not adult, they're adolescent. And so that coupled with this really complex intersection of adolescent development, both physically and psychosocially, with a diagnosis of cancer. So cancer really wreaks havoc on their bodies, on every sort of psychosocial realm of their development. And they've been actually recognized globally as a really distinct population of patients, that they really struggle with a cancer diagnosis. They experience more significant mental health outcomes compared to both children and adults. And I think that's quite well established that they're actually a really vulnerable patient population that has vulnerabilities that are different from both children and adults.
So going through adolescence can be a difficult time for any child, mm-hmm. any person. Mm-hmm. So maybe you could talk a little bit about the vulnerabilities that an adolescent goes through mm-hmm. in this situation.
I think sometimes as clinicians and researchers, we begin to think about this population as adolescents with cancer instead of adolescents who happen to have cancer. And the challenging thing for this group is that, just like their typical healthy peers, they're moving through these really difficult kind of psychosocial milestones of development, but they're in this context of a cancer diagnosis and treatment, never mind advanced cancer, that really challenges and threatens those milestones. So, for example, an adolescent is becoming individuated from their parents, they're developing autonomy, they're having a voice, some independence. A cancer diagnosis for children and adolescents, treatment is very intense and very acute. So an adolescent is admitted to hospital for months at a time. So their typical peers, their parents are moving away from them to a young person with cancer. Their parents are with them 24/7. Their peers are often not sort of emotionally able to cope with their friend's cancer diagnosis, so they get left behind. And so every sort of psychosocial or, developmental milestone is really challenged by a cancer diagnosis. And just the extent of treatment and what's required for them. There really is a significant impact, I would offer, on kind of every facet of their psychosocial development.
Well, let's touch on one of them. When they're isolated from their friends, I'm sure there must be feelings of missing out. Mm-hmm. Maybe you could comment a bit on how you're studying the quality of life in this group.
Yeah, absolutely. It's quite surprising that this population really, there hasn't been attention to quality of life. Why we haven't really collectively considered their quality of life as a unique patient group is really kind of due historically to adolescents being considered as children or adults in oncology. And that, reflects how healthcare is delivered to this population. We treat them in pediatrics or adult care. And so kind of adolescent-centered palliative care is really in its infancy. And this gap is also sort of made larger by the fact that although fewer adolescents compared to both children and adults may benefit from continued advancements in curative treatment, they will benefit from advances in treatment that's designed to extend their life. So many adolescents will live with advanced cancer for an extended period of time. And this is the population that I'm really curious about. They're quite invisible. So this population that's living with advanced disease, but without kind of under the threat of immediate death. So they're sort of living, but also living with a disease that's cancer that's unlikely to be cured. And this population is really quite invisible. And there hasn't been any work done to conceptualize what quality of life means. And quality of life might, for advanced cancer might be very different from end of life, where people might be more concerned about, pain and physical symptoms. For this population, many adolescents will have mild symptoms. And so we have no way of sort of assessing their quality of life, really understanding what's meaningful to them. And so that's what my research is hoping to respond to. Extant research has sort of explored this topic with parents and healthcare providers and not with adolescents themselves. And so my research actually involves adolescents with advanced cancer to work with me to help conceptualize what quality of life means to them so that we can understand it in relevance to them to make it meaningful.
So how will your research uncover these elusive elements for quality of life?
So the final kind of product of my research will be a kind of a validated instrument of quality to measure quality of life. And so in different phases of my research, adolescents, again, will be sort of integrated to help me kind of identify these conceptual domains to develop an instrument to measure quality of life. And I think just talking to adolescents about what life is like for them, what's important to you, what's meaningful to you about this time in your life living with cancer that's unlikely to be cured. So I think really, harnessing their voices and listening to them will help kind of identify and really give us a sense of what's important to the quality of life for this population that we currently don't well understand.
So I know it's early days in this area of research, but are there any emerging insights into key elements in the quality of life that these young patients want?
Yes. In the first phase of our study, we actually went to social media as a source for data and primarily used TikTok. And we were really surprised with the richness of data that was coming from TikTok. We weren't sure if this would be a robust data source or not. But many adolescents living with advanced cancer were posting about their experiences, kind of hundreds of stories about living with advanced cancer. And so from that, we've kind of developed a conceptual framework, a preliminary conceptual framework of quality of life that we're going to validate, that we're validating soon with adolescents living with advanced cancer. But interestingly, what we're learning compared to what is known is, again, this return to pain and physical symptoms. And surprisingly, pain and physical symptoms has not been a significant focus of the adolescents whose social media we've been using. Again, this isn't to imply that it's representative of all adolescents' experiences, and that's why we're doing research with a diverse sample living with advanced cancer. But I think, what's more important to them from our analysis are things like leaving a legacy. Like, did my life matter? A really important kind of proposed concept of quality of life for this population seems to be, making a significant impact, like wanting to contribute to the public good. I was surprised, and even as a clinician working with this population and kind of hearing this discourse from them many times, but, adolescents really wanting to, find a cure for cancer and propelling people to fundraise to cure children and adolescents' cancer, and the injustice of children and adolescents getting cancer and then dying from cancer. And these young people are, ones that know that they're not going to benefit from this call, but really wanting to kind of contribute to the public good. And I think that's really different when we look at research that's done in quality of life with this population, where pain and symptoms, again, from the perspective of their healthcare providers and parents, is the most important thing. Whereas I think we're beginning to understand that it's just much more nuanced than that. And there's, I think, again, this intersection of their development as an adolescent with the advanced cancer that, I think an adolescent too, right? I want to be an individual. My life matters, right? And that, I think those developmental themes, I think we see are beginning to play out in our research.
That's really interesting because obviously that's something that you would typically see in adults over a certain age start to think about what is my life meant? What am I leaving behind? But these adolescents are, they're being backed into this position at a very early stage in life.
Yes.
So, wow, that must be fascinating to go through and examine. I want to ask you a couple of questions about almost sort of the mechanics of the healthcare system.
Sure.
So we know that what's really unique about this population is that they're not children. They're not adults. It's a transition from childhood to becoming an adult. So I'm wondering, how does that affect their experience in our healthcare system? They're kind of caught between pediatric versus adult healthcare systems.
Yeah, it's a significant part of their experience, I think. We've done a lot of work over the past 20 years to really highlight adolescents being a distinct group of patients. And this is really a global awareness of adolescents being a distinct patient group. But prior, they weren't considered distinct. And so I think in their current healthcare, they're still tucked into pediatric or adult models. And just as a really pragmatic example, so if you're a 17-year-old in BC, for example, the GP may refer them to a pediatric hospital, or they may get referred to an adult hospital. But in both places, the care is not well aligned developmentally to the needs of adolescents. And I would argue that, a pediatric setting is more appropriate for adolescents and young adults. And I think clinicians have given a bit more thought collectively that we need to do something different. Whereas the adult oncology system hasn't quite caught up, where I think in pediatrics, when we see an adolescent patient, I think most clinicians would say, oh gosh, I may not know exactly what to do, but I know I need to do something different from my 6-year-old patient I just saw. Whereas in the adult system, they're treated quite similarly, whether you're 18 or you're 65. So I think in both settings, neither is well suited to adolescents with cancer. I think in pediatric oncology, we've sort of, this, awareness that adolescents have distinct needs, but I don't see quite the same formalized awareness in pediatric palliative care yet. And I think we still get trapped in kind of thinking about them as children and adults, when in fact they have unique experiences, and the system isn't caught up to those experiences or the recognition of those experiences yet. We've used the term the lost tribe, so this kind of group that falls between the cracks of pediatric and adult systems. And I think that's probably still in play, where, clinicians themselves haven't realized that adolescents need different care than they offer to children and adults.
So do we need a specialized pediatric healthcare system that accounts for these challenges faced by adolescents?
I think we do. In the UK, for example, there are specialized hospitals or part of an oncology ward that's just for adolescents and young adults. So it's a group called Teenage Cancer Trust, TCT, and they've created wards just for adolescents, young adults diagnosed with cancer. And there's so many benefits. They're being cared for by clinicians that are comfortable talking about sexuality, fertility, kind of these very adolescent, young adult developmental topics that not everyone's comfortable with. They're getting an opportunity to see peers with cancer physically around them and to have the experience somewhat normalized in this very abnormal context. And I think what I didn't note earlier is that the complexity of caring for adolescent cancer is that sometimes adolescents, their cancer resembles more of a pediatric cancer, and sometimes their cancer resembles more of an adult cancer. And so you can imagine the complexity of an adolescent with an adult cancer being treated in a pediatric hospital who needs kind of the expertise of the adult oncologist, and then vice versa, where you have an adolescent treated in an adult hospital, but diagnosed with a pediatric cancer and needing pediatric expertise. And I think the UK really then brought those folks together, right? This
Having
sort of
a team model.
As a team, a medical and psychosocial group that had the, the oncology and the psychosocial oncology expertise to really wrap around the care for this group of patients, as opposed to them sort of just being scattered throughout pediatric and adult healthcare systems that we have in Canada.
I could imagine being a part of that team, even being a psychologist or a counselor, because I'm thinking about the situation where over the course of treatment, big decisions are being made that are going to directly impact the quality of life of the patient. And the patient, there's going to be a wide range of maturity. And I guess my question is, how much agency does the adolescent have? And who's the ultimate decision maker?
That's such a big question. And I think one that clinicians wrestle with very frequently in the care of this population. So in certain provinces, there's no age of consent for youth. And so if someone is kind of assessed to be a mature minor and demonstrates that they understand the medical context and the implications of their decision-making, the healthcare team would, honor the voice of the young person. I think where it gets complicated is, for example, a 14-year-old, a 13-year-old, maybe initially diagnosed at age 4 and has had multiple relapses of leukemia. And then maybe they're in their 5th relapse and they're 13 or 14. And they say, like, I don't want to do this anymore. And for parents, the parents, of course, want the child to receive the treatment. And the parents also know that, the successive treatments that the child has received has actually launched them into remission. So maybe this 5th time would launch this person into full remission. So often we have this context where, the adolescent is saying, I don't want to do treatment. And the parents are saying, we want you to do treatment. And so, I think how we kind of navigate that is really taking a family approach to these kind of situations, spend time with the adolescent, really trying to understand what they want, make sure they understand the implications of their decision, but also then spending time with parents and helping them really understand what's informing their resistance. I think at the end of the day, family, parents, caregivers want the best, what's in the best interest of their child. And if their child really wants to stop treatment, often parents will decide. So I think we will protect the agency of the youth, but it is a lot of navigating with parents and family to really be able to do that.
So in the course of doing this research, has your view of adolescence changed?
In my postdoc research, I think not so much, but I think it continues the thread of my PhD research, which really changed perhaps not my view of adolescence, but realized that we understood adolescence in these contexts in a very essentialized way. And if I could just give you an example to highlight, my PhD research was on kind of investigating early post-treatment experiences of adolescents who have recently completed treatment for cancer, and noticing that many of them 12 months after surviving cancer were having increased anxiety and depression and suicidal ideation. So I was thinking, like, gosh, what's happening with these young people and what could we do to prevent it? And so I think not only did I realize that, how we understood this period of time has been quite essentialized. So in this case with distress, I also realized that we get in the habit of thinking that, these kind of struggles are outliers, right? And that, they need a program and that outlier will be alleviated. And now I realize that, it is such a complex experience, adolescence in general, and coupled with a diagnosis of cancer, living with a life-threatening disease, that in fact, the outlier is the one who doesn't have any challenges, right? So we need to pivot in terms of how we understand the complexity of this population and to expect them to have struggles. And that to me was a big turning point, I think, for my PhD research that's continued to inform how I think about adolescence currently.
How do you think that your research could change everything? And what practical changes would you like to see in the healthcare system?
I want there to be a recognition that adolescents living with advanced cancer in palliative care or pediatric oncology programs have distinct needs, and these needs are not currently being met. This is quite an invisible population currently. We know so little about adolescents' voices about these things. We haven't asked them. And so I think, bringing attention to adolescents' voices, really developing an adolescent-centered approach to palliative care, I think will then kind of infiltrate into better care provision for this population of young people. There are really significant and well-recognized gaps in clinical practice. And I think just bringing attention to this population as distinct, using their voices to understand this distinctness, hopefully will fill in some of the gaps and allow clinicians like myself to better care for them clinically.
Tell me about the next step of your research journey.
I hope by the end of my postdoc that I will have developed a validated instrument. And so I think the next step naturally would be to focus more on implementation. It would be such a shame to spend all this time and energy into developing an instrument to measure this population's quality of life without it being uptaken in practice. So I think probably my next step will be some focus on implementation science and really thinking about how this can be uptaken in practice. I think also it's such a gift to be a postdoc and to just surround yourself with interesting ideas and things that are meaningful. And so I've, along the way have also just come up with other questions I have about adolescents living with advanced cancer and kind of, I think, topics of research that will have been informed by the process that I'm undertaking. But I think we'll still focus on adolescents living with advanced cancer.
Well, the fact that you need to create a validated instrument shows, how new this area really is.
Mm-hmm.
So some researchers I talked to always knew they were going to go into their area of research, and some just kind of stumble into it. What was the case for you?
Definitely a stumble. I was really happy being a clinician. I'm a social worker by disciplinary training. Loved being a clinician, developed an adolescent-centric practice in the pediatric oncology program I worked in, and loved it. And then one day I was really smacked in the face by a clinical curiosity where an adolescent yelled at me something. And it really changed the course of my life, ultimately, that it brought attention to something that I hadn't ever thought about and ultimately led me to do a PhD. What she yelled at me was the topic of my PhD, and thus, led me to pursue a postdoc. So was really never intended to pursue kind of an academic path, but really driven by clinical curiosities, gaps in practice, really understanding and feeling the vulnerability of this population and really wanting to do things to enhance, the care in their lives, ultimately living with cancer.
What did she yell?
She yelled, why doesn't anyone understand that, recovery from cancer is the hardest part of having cancer? And this person was diagnosed with a very aggressive cancer, had very aggressive disease. And I think as a clinician, I'd, paid a lot of attention and I developed these standardized approaches to taking care of adolescents and diagnosis and treatment and all these things. And then after cancer, I just didn't think I don't think I thought much about it. It just felt like a smack. And then as I started to pay attention to other adolescents, I was like, oh my gosh, all these young people are struggling after treatment and we don't even talk about it. It's not represented in the literature. It's like, I'm going to do a PhD and figure out what's happening with them. So that's what I did.
Well, I think she asked a very fair question.
Absolutely.
Andrea, it's been a pleasure. Thank you so much for telling us about your amazing research that I really didn't know much about before speaking with you. And as a token of our appreciation, we have a little gift for you that connects with your research.
Oh, thank you so much. I've not heard of this book before. It's a book titled When a Kid Like Me Fights Cancer. Thank you so much. This is so resonant. So it's been a pleasure to talk with you today, Joe.
Thank you, Andrea. I'm Joe Kim. Thanks for listening.
This Could Change Everything is produced by the McCall MacBain Postdoctoral Fellows Teaching and Leadership Program here at McMaster University. Check the show notes for more information about our program and Andrea's research. Please rate, review, and subscribe wherever you get your podcasts. This is Katie George. Happy researching.